And after a weekend that saw roughly 24 hospital ER and ICU closures, Ontario's health minister agreed to finally discuss the issue with CP24.
Now, it was her first interview, and while she didn't offer any new solutions, Sylvia Jones says she's confident in the province's current plan.
I can tell you that working with all of the partners that are involved in this situation, whether it is the College of Nurses, the RNAO, the hospital, the OMA, all of them together understand the urgency and are bringing forward solutions. We've done a lot in the province of Ontario. Over 10,500 new healthcare workers are working in the province of Ontario that weren't working here 3 or 4 years ago. We have over 600 new internationally trained healthcare providers working in hospitals in Ontario that we didn't have 3 or 4 years ago. Can we do more? Absolutely, and we will do more.
Now, Dr. Kashif Pirzada is a Toronto emergency room physician and joins us live via FaceTime this morning. Good morning.
Good morning.
Dr. Pirzada, let's talk about this. You're a Toronto ER physician. What are you seeing at your hospital right now?
So we had a really busy, long weekend. The same thing, staff shortages. A lot of us, including myself, had to work extra hours over the weekend to make things work. Especially after a holiday, you get a big crush of people. The COVID admissions have been steady. A lot of elderly people, even fully vaccinated, coming in. So I can see why the ICUs are filling up. Even all these unvaccinated people as well. So it's quite busy. It hasn't really let up. Hopefully this wave is cresting. But we'll see. And then another one will come in 2 months, so we'll see after that.
Yeah, right. So we've got the COVID wave, but you just have generally, people get sick, get injured, things happen, right? Life happens, as you well know, and you see it firsthand every day, Dr. Pirzada. So what are your concerns right now for patients and the level of care they're getting under this current staffing crisis?
It's not good. Like, if you look at what's happening at UHN, that's the major transplant center in the province. When it hits the trauma centers like Sunnybrook or St. Mike's, you basically can't get into an accident and you won't have a place to take care of you. If you need an organ transplant, UHN may not be able to take care of you. So these are critical parts of the system that fail, and they're not meant to fail. And this has never really happened before. So that's my concern, is that if the solutions aren't brought forward, in the fall, when we have another wave, which is inevitable when schools open, if monkeypox gets out of control, like it's getting out of control in the US, then we're going to be in big trouble. So they have to do something, like something creative, something effective. Otherwise, we're going to be in a lot of trouble in a couple months.
Yeah, Dr. Pirzada, Ontario Health is saying that, the most critical challenge right now is the shortage of nurses. We've been hearing from the Registered Nurses Association of Ontario saying that retention and recruitment is an issue. So this sounds like a long-term thing that needs to be fixed. But in the immediate term, what can be done to kind of alleviate all the stresses in ICUs and emergency rooms at the moment?
So the work, nurses' work in the ER and the ICU, as well as physician, is very stressful. And if a lot of nurses have gone to easier work elsewhere. I would say offer danger pay. That's one thing you can quickly do, and tell people, we need you. It's a war right now. Get to the front line. That's one thing that could really help. I think expanding ERs and urgent cares across the province is useful as well. But overall, really start to take leadership, do daily meetings like you had with the media, like politicians did at the start of the pandemic. Really take this by the horns and fix it, because people need this system to work properly. You need a system that's reliable, that you can count on if you or your relatives get sick.
And the other thing we're hearing, Dr. Pirzada, is the idea that doctors are having to do almost too much administration rather than patient care. What's the balance like for you? How do you feel about that? Are you doing too much on the admin side versus, saving lives?
So yeah, one thing is a lot of our hospitals in the last couple of years got electronic records, and that forces a lot of paperwork burden on us. So in places that brought it in and it wasn't done properly, you can lose 30–40% of your productivity. And the same applies to the nurses. So if you bring an IT system or other burdens onto your staff and you don't compensate for that, you're going to have problems like this. So combine that with COVID, with staff shortages, that's what's creating the problem now, I'm sure.
Yeah, really complex issue. Dr. Kashif Pirzada, thanks so much for joining us this morning to chat about your experience.
Thank you, Doctor.
Thank you.